Welcome everyone to our Practice Builders webinar series. My name is Lyra and I'll be co-conducting today's webinar. Tonight's webinar will be introducing our newest technology solution, myPracticeBuilder. And before we get started, I wanted to quickly address a few items regarding the webinar. All attendees will be muted for quality purposes, and therefore if you have a question during the webinar, feel free to type it into your chat box and we'll address it during the Q&A session. Also, once the webinar has concluded, every registrant will receive a copy of the PowerPoint slides that you see here today, as well as a recorded version with audio. And for those of you who are not familiar with Practice Builders, I'd like to offer a very brief backgrounder on who we are. We have been providing practice success solutions for over 30 years, working exclusively with private healthcare practices. We provide comprehensive solutions ranging from e-media solutions to staff training for your practice. And now, I'd like to introduce our presenter for tonight, John McCumber. John has a breadth of experience with technology solutions related to healthcare marketing, and we're so pleased to have him here today. May I present John McCumber. Hi, John.
Hi, Lara. How are you?
I'm well. How are you?
Fantastic.
Great.
And I want to thank everybody for attending today. I'm really excited about what we're about to discuss. I've been in marketing for 20 years now, and this is honestly the best solution that I've ever seen as far as helping practices really dig into where their inquiries are coming from and really help improve conversion rates from inquiry into new patients. And this is an amazing solution that's going to make your life a whole lot easier and really help you really take your practice where you want it to go. I live in Austin, Texas, and I am very excited to be on the team here with Practice Builders and to present this solution to you. So essentially today we're going to talk about three things. We're going to talk about your practice in 2011 and what you've been doing in the past and the things that you've been struggling with as far as new patient development and where you're going to go this coming year and how we're going to get there through tracking, converting, measuring, and then adjusting your new patient development activities using this new technology solution, myPracticeBuilder. And then finally, we're going to go through a case study, and we're going to look at a custom ROI, or return on investment exercise for a practice, and we're going to look at how much profit they were losing each month, and then figure out ways that we can earn that money back. So first of all, there are, in our conversations with thousands of practitioners across the spectrum, we've come up with 5 common pain points that practices have in getting new patients. And the first thing is that practices are having a hard time getting a really good handle on data about where patients are coming from. They know that, for instance, they know that maybe more are coming from online, but where online? They've done some research, but where's that coming from? What are the things that are happening when someone decides to make that phone call, and what's prompting them? The next thing, and of course this varies by different specialty, but there's excessive no-shows. It's absolutely killing practices on a billing per hour basis when you've done all the work to get someone in there and then they just don't show up. And how do we address that? Third is a lack of technology and resources to control patient communication. And what I mean by that is just the different ways that we communicate. Something that from telephones to email to text messages, is there anything that, what we communicated in to whom and in what order did we communicate with someone? The next is that the ratio of inquiries to new patients is too low. A lot of you might track how many new patients you're getting, but are you tracking how many inquiries, how many phone calls, how many emails, how many website inquiries are coming through? And we're finding that there are too many that are falling through the cracks. And then finally, a lot of practices don't know what their new patients think about them. They don't have a good feedback loop. And of course, all of this experience is coming from what we've been able to learn from our Practice Builders clients. And in particular, in why inquiries are not becoming new patients, the fact is simple is that a lot of callers are not being welcomed. The phone ringing in your practice is the most beautiful sound you can possibly hear. That's what makes everything else possible. Without that, nothing else would exist. And so making sure that we spend the time and attention to tenaciously address the concerns and make them feel welcome is paramount for success. And that in website inquiries, which I'll show you an example of here in a few minutes, those have to be answered in minutes and not hours. You You've got people out there that are searching for you online, they're entering information, that want to be contacted, and you've got to get back to them immediately. And that goes in part and parcel with the whole prospective patients have to be nurtured. We've got to do a lot more to earn someone's trust and respect than we've had to do in the past. And one of the reasons that's not happening is because the staff is overworked and they just don't have time to manage the new patient inquiries as effectively as they should. A lot of times the doctor and the staff don't even know when the inquiries are coming in or even what advertising sources are delivering new patients. And so what we've developed to address these concerns is myPracticeBuilder. It is a secure web-based technology solution that essentially does four things. myPracticeBuilder will track where all your inquiries are coming from. It'll help you convert those inquiries into new patients. It will then show you, it'll give you the measurement tools to show you what's working and what's not. And then it'll give you the ability to adjust those activities to maximize return on investment, to improve billing per hour, and maximize profit. And as far as tracking is concerned, everything that you're currently doing or will ever do, online or offline, will be tracked automatically. Every incoming call, every referral from either a referring physician or from a patient is tracked. Every marketing dollar that you spent is tracked for you. It's all done automatically and very, very easily. So whether someone is calling off of a print ad or, in this case, Yelp or from social media, regardless, all of that comes in and is tracked automatically by its marketing source. myPracticeBuilder also features an advanced call tracking system where we're able to track 100% of the callers from all of your marketing sources. And each call automatically becomes an inquiry inside of PracticeBuilder. We use unique phone numbers in your area code, which I'll show you in a second, that will track those, and we'll also record them for training purposes. So you can listen to the calls that your staff is taking and be able to track where the calls are coming from virtually anywhere. All you need is an online connection. So for an example of call tracking, let's say your area code is 310, and we'll set up in blocks of 10 different, and it takes merely minutes to do, different phone numbers from your website to your billboard to Google Places. All of those will come into one source, come into your regular phone number, and come straight into myPracticeBuilder. So if a call is originated calling from the website, it'll come into your office. It'll be tracked in myPracticeBuilder. And then same with Google Places, but all of those will be tracked automatically. An example, and I'll show you a real life example of this here in just a few minutes, but a lot of you are starting to use website inquiry forms so people can, that prospective patients can leave a message for you and be contacted when it's convenient for them. Those come in automatically into myPracticeBuilder. So as someone fills that information out, it's brought in automatically, it's tagged by the source that it came in, and it comes in real time to your staff so they can be proactive and respond to them immediately. Of course, the staff is alert. In order to do that, we alert the staff through email and or text, and we can even send targeted email campaigns based on what they inquired about. So if you're in a specialty or if you have a service or procedure that they inquire about, you can start a series of emails automatically that are sent out as soon as they express interest. Appointment reminders are sent via email and text, and then, of course, again, all incoming calls are recorded for training purposes. A lot of times when I talk to practices, when they have an inquiry form like that, they'll say, well, yeah, we'll get back to them later today or maybe the next day. But think about it. When you're out there and you're looking for something online and you ask to be contacted, you want to know that it's being received, that you're being responsive. And so what we've developed inside of myPracticeBuilder is the ability to set a stopwatch, so to speak, so that when that inquiry comes in, and let's say we said no, during 9 to 5, Monday through Friday, no matter what, we're going to respond to everybody within 25 minutes. Well, what happens if Susan's out at lunch and there's 1,000 things going on, and minute 26 rolls around? Well, then automatically a text message and or an email can be sent either to the doctor, to the practice manager, whomever you designate, to say, look, we've got somebody out there, and we've got to be able to respond to them. And so that's what the solution does for you. It's just another it's just a tool to help your staff become more proactive and responsive to your patients. And of course, email campaigns that are personalized and specialized to the needs of the individual are sent out in a sequence manner, and I'll go into more detail about that in a second. And then this is really, and what I'd like you to spend just a second to look at here. This is really the heart of why myPracticeBuilder is such a huge boon for so many practices, is that a lot of times when it comes to follow-up, follow-up calls with prospective patients, most practices will only make one follow-up phone call. But as we've been teaching at Practice Builders, and as it only makes sense, sometimes it takes 4, 5, 6 calls even to get a hold of and to set an appointment for even the most hard to pin down patient. And so what we build into myPracticeBuilder is a series of callback lists. So it's set for each different patient. We'll even recommend what time you should call someone. So if you called someone on Monday and Tuesday in the morning and didn't get a hold of them, it'll even recommend what time and what day you should call them that'll be most likely to get a hold of them. So in addition to that, of course, the email campaigns that will go to help build trust and respect with the practice are done in coordination with the phone calls so that no stone is left unturned. And an example of that, the email campaign, again, this is just an example. The email can go out automatically. We'll introduce the practice, include testimonials, invite the patient for a consult or come in for an appointment, and ask you to follow them, ask them to follow you on your social media endeavors. And then, of course, the phone call will go out after that, and then perhaps 3 days later, another email will go out. They'll show before and after photos and some appointment times and so forth and so on. Of course, the emails will stop and the phone calls will stop once the appointment is set, but these are things that happen automatically behind the scenes. There's nothing your staff needs to worry or concern themselves with, and this works on your behalf and just multiplies the effort that it takes and minimizes the complexity that it takes to address all these different ways that patients need to be communicated with. And of course, when an appointment is made, an email reminder will go out instantaneously. It'll even contain an Outlook, a Google Calendar, and a Yahoo Calendar reminder, kind of like what you did for this webinar today. You should have received an Outlook reminder. The day before the appointment, another email will go out with a Google map from their house to your office so nobody gets lost. And then if the patient does request it and you get their cell phone number, we can send a text message the morning of their appointment. So again, the whole idea is to minimize no-shows and increase billing per hour. And of course, as a result of all of this, I know some of you, and many of you, hopefully, are tracking where the calls are coming from. Do you know the conversion rate and the profitability of each marketing and referral source that you're currently using? Well, now you will. And you'll know what works and what doesn't, and you'll even be able to evaluate and perfect staff performance. And through that, you'll be able to have what we call the doctor's dashboard, where you can look with absolute visibility and look at everything that's going on in the practice and give you eyes in and transparency into what's happening in your practice in a way that you haven't before. You'll be able to eliminate marketing expenditures that aren't producing results. You'll be able to monitor the staff performance and hold them more accountable to the goals that you've set for the practice, and make those small incremental changes in workflow efficiencies so that the practice it looks perfected and it's really coming. It's a well-oiled machine from your patient's perspective, and that's really what's paramount. Favorite things to go through with doctors and practice managers as over time is to look at where the inquiries are coming from. And of course, this changes over time. Just a few years ago, we didn't have anything like Yelp or some of these specialty websites that are out there or SEO. And it's fantastic to look at as the market changes, as your patients are using new sources to seek you out, to make sure that you're responding to that and that your allocation of resources is attuned to that. So to be able to look at this over time is paramount. And then, of course, the most important thing, and I'd like you to pay attention to what's on the screen here, is that we've got, these are new patient inquiry sources. So for every patient that called, we've broken down by the source that they called. Remember, we use the tracking numbers to designate which sources they came from. So in this case, a magazine ad, billboard, even down to a website. We look at the total number of inquiries. And that's an important number. And you may be tracking that already, but this next number is paramount, not qualified. So does that billboard, which is generating 61 inquiries, well, 74% of those folks weren't qualified. So it can make the phone ring off the hook, but it's not the right kind of patient. It's not where you need to be spending, it may not be where you need to be spending your marketing efforts. What's still pending, and then what's a scheduled consultation or an appointment. And then finally, look at the expenditures versus the revenue. So where this magazine ad, we spent $2,000, we made $172,000, resulting in an 8,500% return on investment versus radio. And again, this is just an example. Where we spent $10,000, only made back $600. And so, regardless of the source, regardless of how you have structured it, how the investment, this will break it all down. This is, I spend $1 and how much do I get back? It's as simple as that, and you're able to reallocate those resources. So you adjust those marketing activities to maximize results, and that's why you're there, is to generate a profit, and you then can eliminate or improve what's working for you. Instead of discarding something as far as, well, it just didn't work. Well, why didn't it work? Was it the wrong placement? Did it just not attract attention? Was it not converting? What was the reason? So perhaps that can be improved. And then one of my favorite things to do is look at you're now poised to take advantage of an expansion of services, or to really build up something, a service or a procedure that's underutilized. You can now, for instance, if there's something that you've been wanting to try out, now you can create the marketing materials, place that out there on a small scale, and look at, as those inquiries look in and as they convert, look at the return on investment. And if it's doing well, you do more of it. If it's not, you retool and you try something else. Improve staff infrastructure. This will give you insight that you have never had before. And then, of course, we as practice builders, one of the reasons we developed this solution is so that we can work with you and look at the totality of what's happening in the practice to figure out what those next steps are and make those adjustments. And a part of those adjustments are looking at those expenditures. What is, where are you spending your hard-earned dollars to generate more inquiries, and adjusting those either on a per inquiry, a monthly, quarterly, or annual basis, and really reset the clock, so to speak, so that you're really firing all cylinders and maximizing productivity and profitability. And that's, in essence, that's the entire solution, from tracking to converting to measuring, and then finally making those fine-tuned adjustments. And that is what makes all the difference in the world. And that's really what myPracticeBuilder is designed to do, is show you what decisions you need to make to maximize profit. An example of that is this study we did with one of our clients that have been on this myPracticeBuilder. On average, they were receiving about 25 new patients per month. And of that, it took 50 inquiries, so between phone calls, website inquiries, emails. There were 50 people per month that were coming into the practice. Of course, they were converting 50% of those and turning into 25 patients, and billing about $1,500 in annual billing for each new patient. That would result in about $37,500. Well, right off the bat, within literally weeks, they were through enhanced through going through and making sure that everybody was followed up, that the emails that went out, all the things that are in place, we were able to increase productivity or produce results 20%, from 50 up to 60. So take it from 37,000 to 45,000 in a net result of an additional $90,000 per year coming into the practice. And of course, that's not the upper limit. You can take it from 60, take it to 65, 70, as high as we can go, because we want to make sure that everybody that has a need for your services, that we answer their questions, we make them feel at home, and that you're the right provider for them. And when you do that, you take those inquiries and you maximize the results. So, how would you like to take a live tour? Well, I'm going to show you a couple of things inside of myPracticeBuilder. The first thing that we're going to do is we're going to look at, this is the login screen in myPracticeBuilder, and we're going to do a couple of things. First, we're going to look at an inquiry as it comes in. So, if you can see here inside of myPracticeBuilder, we've got all the different inquiries that have come in by date, the rep that took them, the procedure they were interested in, the source that it came from, how many times we've called them and whatnot. But we're going to create a brand new inquiry right off the bat. And here we've got an example of what a plastic surgeon has developed. And we're going to put in the procedure, and we're going to put in, let's say, liposuction. And we're going to type in, need help now. I forget my typing there. And let's put in Kirstie Alley. And let's put in, let's put in my email address. We'll put in my phone number. And the best time to contact me is anytime. So at the moment I hit submit, just give that a second. It'll go. And within moments, we're going to go back and we're going to refresh the screen here for myPracticeBuilder. And you can see that there comes Kirstie Allen. Came in instantaneously. She's interested in liposuction. We can go in. From here, we can call her. So we can click call now. Her number appears, and then down at the bottom, it'll show the first activity that's taking place with this prospective patient. We can schedule a consult. We can set a reminder if we get a hold of her. Now, keep in mind that one of the things that what she was interested in was liposuction, and so they're built into this. And we'll work with you for your practice, set up a series of email campaigns specific to the procedure. And so there's already one underway that's being sent to her. So before the staff even contacts her, we're being shown as responsive. Instantaneously, we're able to contact her and address her needs. And then from here, we can send an email and then start the entire process. And as you can see, over time, there are numerous things that we can do. And as a result of that, you're able to, and I'll show you the next thing, is that you'll look at the scheduled number of patients per month. You can see the growth of the practice. You can see where the inquiries are coming from. So you can look at this on any reporting regimen that you want, either bi-monthly, weekly, or annually, or year-to-date. You can look at the performance of your reps, how many calls they've taken, what percentage that they've scheduled. I'll get back to this patient status in a second. And then down here are all the inquiry or lead sources that are coming in. So every inquiry that's coming in, how many came in, again, it's key. What percentage were not qualified, what's still pending, what has resulted in a scheduled consultation or appointment, and then looking at the expenditure versus the revenue and looking at the return on investment. So for in this case, this bill site had 4 inquiries, 3 converted. We had, it cost us $200, but if we were able to bill out $5,000, obviously a little bit better in the stock market nowadays. And we can compare that and contrast that with the different methods that we're using to drive patients in. We can even do that with inquiries if you're a specialist with other referring physicians, just like you can see referrals from different practices here. And then finally, patient satisfaction. Built into myPracticeBuilder is the ability to contact each patient after they've had a procedure or had an appointment or a service with you and ask them for their feedback. And that'll come back into the system once they respond via email. And you will see the day they provided the feedback. They'll give you a rating. They'll put in their comments. And then they'll even give you permission to publish this to Facebook, to your website. And in the future, we'll talk about even more methods that we can use to publish that feedback. So that's the solution on how that works. Now, as far as the levels of service that we have essentially have 3. The first level of service we'll call 1. It's designed for many of you that are out there, regardless of the number of front office or back office staff that you have. It's designed for 1 physician, 1 office location. And look at what's built into this. Integration with every marketing source that you're currently using will give you all the tools that we talked about earlier, response time tracking as far as responding to patients quickly, creating the email campaigns, the text message reminders, the reports that are built in, the call tracking with 10 numbers, and you can get additional numbers in blocks of 10, and scheduling the consultations, the emails that go out, the maps that go out, the text message reminders, all of that's built in for only $349 per month. So what we looked at a minute ago, we had a practice that just right off the bat was getting $90,000 a year of additional revenue. We're talking about for only $349 per month. That's possible for your practice. And if you're with a larger practice, it's $449 per month for 3 physicians and 3 office locations, and 6 and multiple office locations for $849. And then we can do custom pricing for practices that are beyond that. So there is some irresistible bonuses that we've built into this. We give you a free tablet computer if you sign up by April 12th, and a free mystery shopper call each month. You tell us what scenario you want us to call about. If it's an insurance call or it's about a particular procedure, we'll set that up. We'll make the call. We'll record it. We'll give you the report, and that way you can make sure that your staff is top notch. That everything that there's any weak links, that we can help you address those and identify those. So that's the presentation. Lyra, do we have any questions?
We do. We have quite a few. So thank you, John, first of all, for the excellent information about myPracticeBuilder. So during the webinar, there were a number of questions that came through the chat, and so we will respond to them in the order that they were received. And so If we don't have
Okay.
time to get to your question, I do apologize in advance. And so what we'll do with the remaining questions that we were unable to answer, we'll just go ahead and contact you directly to get those answered for you. Okay, so let's get started. So question 1, Practice asks, we ask patients where they heard about us, and therefore we go ahead and log it. How will the solution help us beyond doing that?
I'm sorry, repeat the question again?
Oh, sure. We ask questions where they heard about us, and we log it. So I guess write it down. How will the solution help us beyond that?
Right. Well, of course, where the calls are coming from is, it is the most important question that you can ask, and that gives you a feel for what's working and what's not. And if you're logging that right now and assuming that it's accurate, that's fantastic. But just as important as where the call is coming from, it is, does that source actually result in a patient? Because phone calls do not equal it would be great if phone calls equal patients, but they don't. Sometimes there are people who are calling and they're not sure, they need some help, they need some reassurance. And so what is the conversion rate? How well is the source? Is it producing the right type of, does its audience or whoever's seeing it, does it produce the right type of patient that is conducive for your practice? And is your staff responding to them? So that's what myPracticeBuilder does. Is in addition to automatically, without even having to ask what source they're coming from, in addition to that, it shows you the conversion rate and the profitability. So for how many dollars did it take to make that phone call ring, and then how many dollars did that phone call produce? That is really the heart of the matter, and that's really what myPracticeBuilder gives you insight to, and collects all of that data for you automatically and reports it. Again, we pull it up and there it is. And so that's a whole lot more powerful than just where did the call come from.
Okay, great, fantastic. Let's see, question. And before we proceeded on to question 2, I just wanted to remind everyone that John has a slide up here. So just to give you information about the expiration date as well as the contact information, myPB at practicebuilders.com to receive more information about myPracticeBuilder. So that's up there for everyone's reference. Okay, so question 2. This is next question. We advertise a little, and a lot of our patients have been referred by other patients. So basically word of mouth referrals. How will myPracticeBuilder help us with, recording or monitoring referrals in myPracticeBuilder?
Well, of course, there's 2 types of referrals. There is patient referrals, and then there are physician or practice referrals if you're a specialist. And of course, this can help track with both of those. And then built into myPracticeBuilder is, in addition to the source that they come in from, and of course, when someone is asked and then answers the question about where did you hear about us, they'll just, and if they have talked to one of your patients, of course, that's the first thing that prompted them. That's what will come to mind. But a lot of times, as we know, it's a multifaceted process. They'll talk to one of your patients or who's one of their friends. They'll go and research you online. They may go to your website. But what is it that happened at the point they made the phone call? That is key. And that's what myPracticeBuilder will track through the tracking numbers that you won't get through that information, because what you get can be somewhat skewed. So if Betty Sue talked to Bob and Bob recommended your practice, Betty Sue might go to Yelp, or she might go to Google and look you up and do some research, or go to Vitals and look at different things, and then she'll make the phone call. But it was the first referral that was spoken, and so this will show you at the point that they made the phone call, what were they looking at. And so it's that call it's literally the call to action that generates the call that we're able to track. And that is key, and that's something that most practices aren't tracking right now. It's what they should be tracking. Also, as far as referring from physicians, I talk to lots of practices that are specialists that get referrals from other physicians. And a lot of times I'll ask them, 80% of your referrals are coming from how many physicians? They'll say probably 5. And so what we do is we set up 5 different tracking numbers that those different practices give out to their patients, So we're able to see where those calls are coming from without even having to ask. And so those will come through, and we can look at, so one referral does not equal another. Just because a physician referred your practice, it's the context. How well did they do it? So you can look at, so you know what relationships to work on based on the conversion rate, and of course listening to the calls. You can listen to calls from one referring physician versus another. They're all laid out for you inside of myPracticeBuilder. And so you know which relationships you need to strengthen and which ones you don't. It's the depth of information that really highlights where you need to spend your time and energies to perfect the conversion from inquiry to new patient. So there's a lot of things that are happening that you're just not privy to. And this, in myPracticeBuilder, not only is collecting the data, but that it's giving you that information back so you can make the very best decisions for your staff and your practice.
All right, perfect. Thanks, John. All right, Third question, and this is a popular question that we do receive quite a bit, so hopefully it'll answer multiple inquiries. Can we still use our current appointment reminder service and still use Practice Builders as well?
Absolutely. There's two ways that we can address that. And it's different for every practice, and we'll have to just dig into it with the way that your system works. In some cases, we can use the two in tandem, and it's very simple to use myPracticeBuilder in coordination with your either your practice management, or if you have some sort of reminder solution that we can either, number one, we can replace that service that you're using now and perhaps reduce your expenditure and use that inside the context of myPracticeBuilder. That's option number one. The other option is that we can actually bypass the reminder system built into myPracticeBuilder, still track the return on investment, and let your current system do its work and let it manage the setting of appointments and the reminders of that. So either way is fine. We do it both ways all the time. It's very common to come across this. But at the end of the day, you want to make sure that you've now got an additional source or additional solution that can make sure that no-shows are a thing of the past. And myPracticeBuilder, again, it's very simple. But it's also very robust. And so there's parts of it that we can use. There's parts of it that we can essentially turn off or bypass, and let the rest of the system continue to work.
All right, great. Thanks, John. All right,
sure.
Next question. So within your slides, John, that you showed us a website form. And so somebody really enjoyed seeing that and how that integrated directly into myPracticeBuilder. Is the web form included with the service of myPracticeBuilder?
Absolutely. What we do is once we create the source that, for instance, let's say it's your website, we will provide your webmaster the code, or in this case, if you host your website, as many of you do with Practice Builders, we can do that for you. We'll actually give you the code that you can integrate that into your existing design and have that up and running in just a couple of days. Very, very simple.
Okay, great. Okay, and this is probably the last question we'll have time for, John, today. And as a reminder, if we don't get to your question, if this is not the question that we are able to respond to, we will contact you directly to make sure that your questions are answered. So thanks again.
I will respond to you immediately.
Okay, good. All right, last question. So my staff is really busy as it is, and adding another thing to the plate makes me very nervous. How do other practices, how are they starting to use this, and what are the first steps to implementing this service?
Well, of course, myPracticeBuilder, again, the My is by design. It is a custom solution. So one of the very first things that we do once you come on board is that we'll sit down and we'll talk about the way that your practice works, the way that your workflow is engaged, and we'll determine the best line of attack. Truth be told, once it's all said and done, there's a whole lot less that is involved in getting it, or changes that you're going to have to make on a day-in, day-out basis than you probably think. But even what we do in some cases is we'll just set up the tracking numbers, and we'll just record where the calls are coming from. And then once we're comfortable with that, then we'll go and start making appointments through myPracticeBuilder, and we'll set up the email campaigns that can that can go out. And then we can go through all the, and then we'll go into the reporting, and we'll have the full, within a very short period of time, we'll have the full functionality. That's really the kind of the stair-step approach. That's the most, it's the most conservative approach. But a lot of times what we'll do is we'll take once we identify what each staff member, what their job is and what they do, we'll spend 30 minutes with them on a webinar just like this, and we'll go through routinely what they're going to do day in and day out. Of course, a lot of everything is already set up for you. We'll set up before even the first patient is taken through the call tracking numbers or the first staff members using the solution. A lot of work will be done by us to get this set up and to get this integrated. So there's very little that the staff is going to have to do, and a lot of times I've had, especially with the appointment reminders, we're like, oh my gosh, this saves us 2 hours a day of having to call people back and trying, and leaving messages and playing phone tag trying to get a hold of someone. Now we can automatically have the email reminders and the text reminders go out. It's such a joy that there's, and all the email campaigns that can go out for keeping up with prospective patients. There's all these things that are set up automatically behind the scenes where the staff doesn't have to do a lot of the busy work that they've had. So again, there's a little bit of change that has to be made, and we will implement practice builders based on the needs of your practice, based on the needs of your staff and what they can accommodate, and we'll show them how simple it really is. And so, we use kind of I use a velvet glove touch with each different practice, and really make the transition as smooth and simple as possible.
Great. Okay, well, great. Thanks, John, again for your information today that you shared. It was excellent. So thank you again for your time. Appreciate it. And
Sure.
I'd also like to thank everyone else for taking the time to join us today for our webinar and learning about how myPracticeBuilder can improve your marketing ROI and new patient follow-up. And as you see here, feel free to visit us online at our website, practicebuilders.com, or any of the social media networks that you see here. And as a reminder, one last time, we will be sending out copies of our webinar slides and recorded versions once the webinar has concluded. For any additional questions, feel free to contact John directly at jmccumber@practicebuilders.com, as well as 1-800-679-1200. Thanks again, everyone. Have a great day.